In the early 20th century, when two giants from distinctively separate disciplines collaborated on the development of an extracorporeal circulation device, I doubt they realized how extraordinarily unique their partnership was. At this moment, we are positioned in a fast-paced world where technology is advancing and globalization increasing, where distances get shorter, competition increases, and expectations are more demanding. A time when we need to make the best use of knowledge and look at each challenge from different points of view. A time for transdisciplinary integration of the sciences. A time when convergence innovation is needed most. Innovative leaders are curiously optimistic as they dare to take risks. And when leaders work together, the capacity to innovate increases exponentially. The world's most complex problems require convergence innovation. Through this approach, we have the ability to live longer, foster a better quality of life, and preserve this tiny rock we call Earth. It's why we are here, for the benefit of all.
Hello and welcome. I'm Steve Igo, along with Dr. Bill Kline, here in the DeBakey CV Education Studios at Houston Methodist Hospital. It is our pleasure to moderate today's Lunch and Learn webinar on dog noses in medicine, presented by Pumps and Pipes. We would like to begin by acknowledging two people who first brought the topic of dog noses to our attention and helped introduce us to today's speakers.
You know, Steve, today's Lunch and Learn webinar is a great example of one of our core understandings here in Pumps and Pipes community. The solution to my problem may very well be found in my neighbor's toolkit. This is Dr. Tim Nedwed, one of our Pumps and Pipes colleagues from ExxonMobil and recipient of the 2013 Edith and Peter O'Donnell Award for Technology Innovation from the Academy of Medicine, Engineering, and Science of Texas. Since 2014, Tim has been educating us about oil spill response technology. And in 2017, he introduced us to Dr. Melissa Nolan, who told us how she was taking advantage of two oil response tools, NASA satellite imaging and ExxonMobil image analysis, to advance her research for detecting mosquito habitats on a global scale. But the problem of pinpointing breeding mosquitoes on a neighborhood scale remained, so Tim was back at our next conference suggesting a solution from yet another neighbor's toolkit. And you guessed it, dog noses.
That's right, Bill. To continue the story, this is Paul Bunker, trainer of dogs for oil spill detection at his company Chiron Canine in San Antonio, with his dog Nika. It was Paul who helped put us in touch with today's speakers. Two things strike me about these photos. One is how intensely Nika is watching the collection of an oil sample at the upper right. The other is Nika's cool shades.
So, if you're keeping score, that's a triple win for dog noses. Oil spill response, detecting mosquito habitat, and as we will hear today, medicine. I wonder what additional ideas our students may come up with.
Well, as we take our students and audience from coast to coast today, we will have student questions that we will be sprinkled between the talks. Bill, let's introduce our speakers.
Okay, our first speaker is Dr. Cynthia Otto, joining us from Philadelphia, where she's director of the Penn Vet Working Dog Center at the University of Pennsylvania School of Veterinary Medicine. Cynthia will let us off telling us about the anatomy and physiology of the dog nose. And then she'll finish our program talking about training dogs and a recently published research on their remarkable ability to detect COVID-19. I know we're all looking forward to that, to learning about that.
Our second speaker is Maria Goodavage, who is joining us from San Francisco. Maria is a journalist and author. She has been a staff writer for USA Today and the San Francisco Chronicle. She has written 3 New York Times best-selling books about military dogs, Secret Service dogs, and most recently, Dr. Dogs. How our best friends are becoming our best medicine. Cynthia and Maria sent their portrait images for these slides. The one for Maria was taken 2 weeks ago when she flew aboard a vintage Huey helicopter, along with a companion dog named Torque. Maria told me that Torque loves to fly and that her job is to calm people during the flight as it is done with the doors open. Torque also is looking cool in her shades. So let's get started. Dr. Otto, welcome to Pumps and Pipes Lunch and Learn. Tell us about how dog noses are so special.
It's great to be here, and I really look forward to the opportunity to share some of the work that we've been doing. So I think one of the first places I'd like to start is to think about how dogs actually experience the world. As humans, we're incredibly visual, and so we can look at this very crazy image that I have here on the screen, and we can see colors, and we can see shapes, and we can see the distinct different things that we can pick out. We can see that there are robots and tents and cakes. And if you're really good, you may be able to spot Waldo. Waldo is the little guy with a red and white striped hat and round glasses. And that is the technique that we use as a visual species. And dogs do the same sort of thing with their noses and smells. So what might seem like a very complex picture to us in the odor world, dogs can pick out discrete things and recognize them and look at them in the same way that we might be able to look at this. One of the other cool things that dogs do is they sniff. And so you can see here in this video how the dog is sniffing and sniff, 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 sniff. And what that's doing is bringing in that air into their nose so that they can sample it and really get that picture. And so I'd like to share with you a video that was created by a colleague of mine at Texas Tech. And so what this is basically doing the same sort of thing as Where's Waldo, but now what we're doing is looking for the difference in these 2 images. This is a game that we play and we look and say, okay, what's different here? Can you see that the wheelbarrow's in a different position? We're kind of looking and comparing all of the differences. And again, visually we're doing that. And dogs do that with their noses. But the thing about us is that when we think about sniffing, we sample 1 sniff maybe every 2 seconds. And now think about that as a visual comparison. We can look at this and compare it to that, look at this one and compare it to that one, and we might be able to pick up a few of the differences in between. And so, did you pick up any of those differences? Did you see that there were some things that weren't the same? Now what we're going to do is, this is how fast a dog processes, and this is processing odor again, and so we're using that visual comparison. Now, if you don't like flashing things, go ahead and close your eyes, because it's going to go really, really fast, because that's how dogs are sniffing at this high of a frequency. And there are differences, and they're able to pick up those differences at this very, very high frequency. So they're picking up lots of odor, and they're sampling it and being able to tell, is this different than that? And that is, especially as we go forward, is going to be really important in what dogs are doing. So what happens after they sniff? That air comes into their nasal passages. And this image here is a really cool image of looking at how the air moves. And a lot of the air, as a matter of fact, most of the air goes right into their lungs and allows them to breathe. But a part of that air, about 15%, is directed to this area of the nose that is called the olfactory recess. And that's where all of this odor recognition happens. And so in that olfactory recess, we have this olfactory epithelium. And it's what we call a labyrinth. It really is a very complex area that allows it to have a lot of surface area. So that surface area allows these olfactory receptors to be very densely packed and have a lot of different olfactory receptors. And we compare a lot of the things about the way the dog is kind of set up. It's set up physically and it's set up genetically, and it's really set up in a way to process the world through its nose. And here's another image of that olfactory epithelium. You can see it's got lots and lots of area that the air that's coming in can circulate around in, and so delivering any of these odors, what we call volatile organic compounds or VOCs, to this area so that the receptors can capture that and then tell that to the brain. Well, now we think about dogs as being fantastic, but really, who has the best nose? Is it our dog friends who we know are amazing? What about elephants? We know grizzly bears, they can smell an odor, they say, from 10 miles away, and I hope I'm always 11 miles away from that grizzly. What about sharks? They have an incredible sense of smell. One of the things that we have to think about, though, is who do you want working in your airport? Obviously, we can't have sharks, and certainly the grizzly bears are not going to be so friendly. The elephants are pretty cool, but they might take up an awful lot of space. And so we really know that the dogs are all around a pretty darn good partner in any of this olfactory, this odor detection. We do know that elephants are good. As a matter of fact, genetically, they are much better and then pretty much any other species. They have more of the genes which create these olfactory receptors, and olfactory receptors are the proteins in that olfactory epithelium that catch the odor and then communicate that information to the brain. So we know that the elephants are incredibly good at that, but dogs aren't bad. So dogs have about twice as many of these olfactory receptor genes as we do as humans. So here's an image of an olfactory receptor. So if we look at this part here at the very bottom of our screen, where the blue arrows are, is where the air is coming in. So that this is coming in through that nasal passage, and now here we are in the olfactory epithelium. The little circles and squares, those are odors, volatile organic compounds. And then these finger-like projections, these are our receptors. So the receptors are going to recognize specific odors, and they're neurons. They're connected here, and they're going to go all the way into the brain and communicate that signal. The other thing, once that signal is communicated, it's communicated in the brain. And we think about, here's one of the dogs in our program. We can see he's got this wonderful nose, this slits where he can do this wonderful sniffing. The air can come out the sides and swirl things up, comes in through that nasal passage, swirls around in the olfactory epithelium. The receptors capture the odor, and it sends that information to what we call the olfactory bulb. This is part of the brain. It's a very specialized part of the brain. And this image is really what we call a prosection. So it's a dog's nose kind of cut in half. But this section of the brain is really big. And when we compare that to the human, it's about 10 times bigger. And here the human, you can't even see that part of the brain that processes that information. And so we know that dogs are physically, genetically, and behaviorally set up in order to capture the information, process the information, separate out what is happening in that world, in that scent picture. And then one of the best things about dogs is that they can then communicate that information to us because of the way we have that relationship with dogs and with people. And so I think that that's really kind of a big picture of what we have on how dogs are built to give us this whole sense of what the world is through their noses. And so that's a very, very brief overview, and we can jump into some questions now, or we can talk a little bit about the program that I work with. I do have a video that we can either use now or we can use later. So it's whatever makes sense for our program and what our audience would like to see.
Let's jump into one or two of the student questions. This is fascinating. Thank you. We provided the teachers and students with some learning materials prior to today's webinar and asked us to send us some written questions. What about the shape of a dog nose? Does a long one or a short one affect their ability to detect these odors?
So that's a really great question, and one that we would think that long nose is optimal for detecting odor. And what we know is that based on a study that was done at Texas Tech from Dr. Hall, who shared that video with us, he did an amazing study. What he looked at was whether or not pugs, dogs with very flat noses, versus German Shepherds versus greyhounds could detect an odor better. So which of these dogs, and we all thought, well, pugs don't have much nose there at all, and so how could they possibly detect the odor? Well, what he found is that even though we think of German Shepherds as being kind of our top detection dogs, at least in the law enforcement field and in our search and rescue world, they're maybe not as good as our bloodhounds, but still they're really, really good. What we found was, or they found, was when they hid an odor, and basically they were hiding some food in an area and asked the dogs to find it, the dogs that were the best at finding it were the pugs. So we lost that sort of bet. And part of that may have been because the pugs are very food motivated and very motivated to do this kind of work. But what we also know is that dogs' sense of smell is so good. It's so good that even with that compromise of not having as much air space in their nose, that they're still very capable of breathing. What we know in the working world, though, is dogs with the flatter noses, they can smell all right, but their problem is they actually have a harder time dealing with temperature, so high temperatures. They can't cool themselves as readily by panting. And so most of our working dogs are going to have those nice long noses. Now, if we look at the other end of the spectrum and we look at greyhounds, those are called sight hounds. And those dogs have always sort of relied on their vision, on their eyes, much more than their nose. They're also not as motivated, shall we say. And I had a pet greyhound for years, a rescue, and he was wonderful, but not maybe the brightest of the dogs that I've worked with. So he just wasn't motivated. He was a great companion. He loved being on the couch, and he's a wonderful dog, but definitely not one of our higher end, particularly for the olfaction.
So let's go to our next question.
This one is from, the previous question was from Gabriella, so thanks for that great question, Gabriella. This next one is from Lex. Is there any way to fool a dog's nose?
Lex, that is such a great question, and there are a lot of people out there who would really like to fool a dog's nose. And so, for all the bad guys out there who are trying to sneak things by dogs, guess what? You really can't fool a dog's nose very easily. So you can do all sorts of things to try and cover up the odor. They are so capable of picking out odor among a huge background. I think our biggest challenge is not fooling the dog's nose, but us fooling ourselves and making mistakes when we're training the dogs. Because they're very, very clever, and sometimes they will pick up on things that we don't recognize when we're training. And that's certainly something that we are very much aware of when we're training for our medical detection.
And thank you, Dr. Otto, for that marvelous presentation, and for the students for sending us their questions. I'd like to now turn this over to Maria. Maria, welcome to Pumps and Pipes Lunch and Learn. I very much enjoyed reading your book. Tell us more.
Thank you so much. It's really nice to be here, especially Cindy is a world leader in this field, and I already learned even more than I thought I knew from that great presentation. I will share, hang on just a sec. My dog is here with me. You'll meet him in a second. His name is Gus. Hang on, look at this. You're seeing him right now. Okay, so this is Gus. He is a yellow lab. In fact, they asked me to have a live Gus in person, so here's some snacks. Hey, Gus. He's sleeping, which, you're supposed to let sleeping dogs lie, but for the sake of, come here. This is Gus in Golden Gate Park, what you're seeing. I don't know if you can see him now. You probably can't hear. That's Gus, and he's all about treats and fun and rewards. Good boy. Okay, go back to sleep. So that's Gus. Yeah, there. That should do him. He's a very mellow dog. But Gus, a lot of people ask me, because my most recent book is about the dogs who detect medical disorders, and it's called Doctor Dogs. A lot of people have asked me recently if Gus is a doctor dog, and there are a lot of Labrador retrievers who are doctor dogs, but Gus is not among them. He probably, here he is again, he probably could be, because he's highly food motivated, as you may be able to see by his wagging tail, looking for more treats. But beyond that, he does have a job. He is a toy finder. Every single time we go for a walk, he comes back with toys and balls, and that's his thing. This was from a time that we stopped at Golden Gate Park. I was doing a little jog with him, and I stopped for about 15 minutes to do some sit-ups and push-ups, because that's our gym now with COVID, right? And this is what he found, like 6 toys, which we brought home and we give to our friends who don't have dogs who do this. So that's his job. He probably, if he lived closer to Cindy's facility, could be trained as a doctor dog, because he has a great nose and he's really motivated. Now, this is his reward. He finds his own reward, that he makes his own paycheck. And so fortunately, the world of doctor dogs does not need Gus. There are plenty of those. And this was actually from Cindy's facility, the Working Dog Center at the University of Pennsylvania. This is a dog who is detecting cancer. She'll be talking about this, so I'm not going to do that, but I just want to show you the different types of dogs that I sort of delineate into 2 fields. There are the research dogs, as there are researchers in medicine who are MD PhDs or DVM PhDs, and those are the dogs who work behind the scenes. And Cindy will be talking about those more, so I will skip those. But this, I just wanted to show you, it's just exactly what Cindy was just talking about, where there are small dogs who do this work too. It doesn't really matter the size of the nose, as this is a dog who's detecting Parkinson's, trying to show the earliest stages which we can detect Parkinson's. And this is up in Washington State. This dog is on it. She's a diva. She's a rescue dog who is really, really good at this. And she works for Turkey, and she does an excellent job. But today I'll be talking about the dogs who work directly with people. These are dogs just like standard doctors who will work with people, kind of like they came for a house call and stayed. They are life-saving, life-changing, best friends. And it's really amazing to me, because these dogs don't need a diagnosis in order to do their work. For instance, the young woman in this photo has a mysterious disorder. It's a fainting disorder, and doctors have given it different names. No one can really quite come up with what it is. She's always being thrown all these acronyms, but it didn't matter to this dog. This dog was trained at Medical Detection Dogs, which is another great place. It trains dogs like this in England. The dog was trained on this woman's saliva and on skin swabs. So they would take gauze and rub it on her skin after she fainted out of nowhere. She would faint in the middle of a street while crossing a street. It was going on for years, and it was really impinging on her life. They trained the dog that all good things came from this scent. So every time the dog would look at the scent, would alert to the scent in any way, they would reward the dog. They put them together after a few months of training, and she brought the dog home. On the way home, they had to stop at a hotel because it was a long drive. The dog alerted that night, the very first night. They didn't even know if it was going to work. It was just a trial run. And sure enough, she lost consciousness within a minute. So they've been together for years now. Even in front of the Queen of England, this dog alerted to her, and sure enough, she fainted in front of the Queen. It's a story that I won't go into because I don't have the time today, but it's in the book. Another use of these dogs directly with people is for seizure disorders. This woman has a seizure disorder in which she has several types of seizures, including tonic-clonic or grand mal. The dog was trained in much the same way, although this was in California, on her saliva, on the skin smell after she went into one of the seizures. And shortly after they met, a few days after they met, and they were in training in Southern California, the dog alerted and it was the first seizure she had had, and the dog caught it. And the dog also has been trained to grab a medical bag to bring her medicine, and also to push a life alert button, which is something really handy because she's often alone when her husband is working in the medical field. So the dog can call him, or the dog can call 911 if need be. It's really amazing. Another similar story, this young man had a very mysterious disorder with life-threatening paralyses. He would become paralyzed out of nowhere. This would often involve him not being able to breathe. And it was very frightening for him, for his family, as you could imagine. And they had to learn how to use the breathing equipment to help him through these episodes. And he never knew when this would strike. Doctor said, no, maybe it's some kind of weird form of migraine. The parents had heard about migraine alert dogs, and so proceeded to get a puppy to try to train with someone who was not near them. But they did a couple of in-house sessions with her, and they trained this dog in a similar way when she was a puppy. Now, this is not normal to train puppies on the scent for medical detection, but they would take Paul would spit into gauze every 30 minutes until he would have a paralysis episode. They would keep the one that was closest to the paralysis and train the dog on it. They would make lots of little baby samples and train the dog on that sample. So when she was little, they would have holes in the bottom of her food bowl, and the gauze with that smell would be under it. So she also learned to associate good things with that. That became training her on treats. Eventually, it became his own scent. It was a long process, many, many months. But within 6 months, she was doing really well. Within a year, she was hitting it almost every time and saving him so many times. It turns out that he has another disorder that was crushing his brainstem. So he's had some surgeries. She's still helping him out, but thankfully he's passed that. But that was just amazing that she didn't need a diagnosis. Something that dogs are very commonly being used for these days is to help with diabetes. People with type 1 diabetes will hit low blood sugar. They may not know it. If they have glucose monitors, the glucose monitors are 10 to 15 to 20 minutes behind what a dog can smell. The dog smells the change in real time. What you see here is a dog with something called a brinzel, which is typical of what dogs will alert with in the diabetic alert dog world. You really need to know that the dog is telling you you've got low or high blood sugar, and this is how they get your attention instead of just sitting or pawing. And this is a young man named Luke with his dog Jedi, and this happened while we were having lunch together. Usually the brinzel is attached to the person, but since he was a child at this time, it wasn't. Now the dog is going to school with him and alerting to him directly, saving him so much, because he can then monitor his glucose and check it and have some glucose, have something to eat. And that's way before he would normally be able to. Dogs, we don't know what dogs are smelling unless Cindy has some new news on that. They don't know. We don't know what they're smelling, but they're smelling it. This is another dog I wrote about in the book. She went to high school with her man, and she now is in college with him. He's becoming an EMT, and he wants to go into nursing, and she's at his side the whole time. She graduated from high school with him. She's at his side. She's a star in the high school, a star in the college. And here's another one of these dogs alerting. Now, this just shows they train them with treats at first. They train them with love and praise, but the dogs really get to know that this is important work they're doing. They love their person so much. And this bond is so deep, especially with these dogs who work directly with the people. And you see that sincerity in the dog's eyes. This dog really wants to, he wants her to take her glucose monitor and look at it and do what she needs to do, because she has some really difficult problems when it doesn't happen. So you listen to this face, and this bond is really similar to what I've written about in military dogs, in my books about military dogs, where the bond goes up and down the leash. This is a dog named Luca who didn't have to do this. She just chose to do this. She normally sniffs bombs for a living, but she was doing this extra protection work because, she's so bonded. And again, it goes up the leash where, the dog knows that you're there for them and they're there for you. And that's the kind of life-saving bond that is also going across the board with these medical detection dogs. They're also these days being used more for mental health. And speaking of war, this man, Will, was a veteran in 2 Iraq war deployments that were really rough. He came back really messed up. He told me about his marriage falling apart, his jobs. He couldn't keep jobs. He was drinking, and nothing was going right. He finally got diagnosed with post-traumatic stress disorder, or PTS now they call it. And they gave him a cocktail of medications which numbed him. He did not like living life. He felt like a zombie. One day he met someone who said, hey, you should get a dog for your PTSD, a service dog. And he looked into it and was matched. He got really lucky. He got matched with this amazing dog who was trained in prisons in West Virginia. And this man lives in North Carolina. The dog was trained with 120 commands because they didn't know what the dog was going to be doing for a living. And they matched, and the dog has completely turned his life around. As with the other people who lost consciousness or went into paralysis or even seizures where they didn't know what would be happening, their dog can tell them ahead of time so they can live life. It's the same with this. The dog, it's not just smell by any means. It's body language, it's their relationship. Smell is maybe one part of it, but the dog can tell sometimes when he's going to be having panic attack, anxiety, and leans into him. And of all the commands he knows, or the requests, whatever, cuddle and snuggle is the favorite for both of them. And his life is completely changed because of this dog. And we're seeing more and more of these dogs being used for mental health. This last one is dogs are more commonly being used for people with anxiety disorders. This young woman is in college in Arizona, and she has a pretty limiting, she's got a pretty bad anxiety disorder, which really almost caused her to drop out of school. But she got this dog, and the dog, again, gives her such a comfort in not, again, the sniffing. He's not even trained on sniffing, but she thinks that he can tell when she's going to have an anxiety attack. And he will sometimes just lean into her and give her that heavy, relaxing weight that calms her down just on his own before she even realizes she's going into a bad panic attack, and she can calm. This is the dog after she asks him exit because she was starting to feel anxious in a store, and he finds the door. He's able to help her exit. So it's pretty amazing what these dogs are being used for. And I think their jobs are only going to increase as we think of what they can do, because as Cindy has told me, if there is a scent to something, you can train a dog on it. And the more we realize about what these dogs can do, the better. I'm going to end this with a quick video I used as a book trailer. And you'll see a lot of familiar faces in this. And you'll also see something Cindy's going to talk about, which I haven't talked about yet, which is a detection wheel. You'll see that in a minute, and she'll be probably talking about that shortly after.
Dr. Dogs, helping humankind. Dr. Dogs, oh what their noses find. Dr. Dogs, sniffing out disease. Dr. Dogs, they don't charge any fees. Saving lives, they're so devoted. These dogs are heroes every day. Oh, detecting cancer and other dangers, keeping illnesses at bay. And for them, it's just play. Dr. Dogs, give a cheer for the Dr. Dogs. Dr. Dogs, helping humankind. Dr. Dogs, such amazing hero dogs. Dr. Dogs, helping humankind.
And that music, I don't know if any of you recognize that, Perry Grip, who is famous for raining tacos and other songs. He wrote the music for that, and I really appreciate that. So thank you. And I don't know if there are questions for me. I will stop sharing my screen. There.
Wonderful presentation. Your books touch on so many aspects of the interaction between dogs and humans. We have a question. If we can put that question up on the screen, please. This question is from Kim. What led you to this area of research, writing about dogs?
Oh, okay, that's a great question, Kim. Thanks for asking. I'm a journalist. I was a reporter for a number of years, and I had written guidebooks on the side on places to take a dog in California, which became a national series, and that was a lot of fun. And throughout the years, I would occasionally write about dogs, and I was writing for a couple of websites and occasionally wrote articles about military dogs. And then the Osama bin Laden raid happened in 2011, and there was all this news that dogs were part of the military, and people were so surprised to learn that there were dogs in the military. And I thought, well, I think I need to tell them more about this. And so that's how I started in the world of books about dogs who work for a living instead of just dogs who vacation for a living. And I love it. My dad was a very young soldier in World War II, and he would tell me when I was a child about all the dogs. He worked with 2 or 3 dogs. He wasn't a handler, but who were with them. And he said they would save lives by day and save souls at night. And I was always mesmerized with what they did. So I feel really, really lucky to be able to write about them for a living.
Well, thank you. I know you travel extensively to interview people for your books, and of course, meet the dogs. So this question is for you from Ria. What is the most challenging part of your research process about writing your books?
Thanks, Ria, for that question. Actually, since you just mentioned travel, I do like to travel for my books. I feel like I need to be there and see and smell and hear what's going on. That's how I met Cindy, actually. And right now, I'm stuck because I can't travel and with COVID. So
Oh, I think we've lost Maria's Zoom.
So let's go ahead.
Story.
Unfortunately. Oh, she's back.
Yeah, sorry, was I disappearing? Anyway, there are definitely many challenges, but finding the really good stories that will exemplify what these dogs do and showing them in their best way. And then getting the science right, and people like Cindy are immensely helpful with that because, as you can see, she's able to explain it in a really easy to understand way, and that's what I seek to do in my books as well. So hopefully I'll be traveling again in the not too distant future for what may be my next book. Thanks for the question.
Well, I hope you travel to Houston soon. So one of the news articles that we provided with the learning materials for the students and teachers was from the Washington Post, dated August 18th of last year, with the headline, "Can Dogs Detect the Novel Coronavirus?" with the subtitle, "The Nose Knows." It was a story about the work Dr. Otto was doing with her colleagues to determine if 9 dogs could be trained to identify the odor of COVID-19. The results for this proof of concept study was published 12 days ago on April 14th. Cynthia, please tell us about your hot off the presses remarkable findings and how this might lead to the development of odor-based screening, either by electronic, chemical, or biologic sensing methods.
All right, so I think I'm sharing my screen now. Hopefully we're all good with that. I think we want to start at the beginning though. So I had mentioned in my earlier part of the talk about VOCs, or volatile organic compounds. And what we're thinking about is how diseases smell. And I think Maria, told you about a number of cases where there were smells associated with different types of conditions. But if we really look back in history, physicians used to use the sense of smell in their diagnostics. There are certain things that have an odor, and I think we've gotten away from that as humans and as human medical professionals, and we really have forgotten about that tool. And so it's really fun to be able to go back to dogs and see if we can't capture their incredible ability to help us use that as an old tool that's kind of now been repurposed for the current day. And when we talk about the VOCs of disease, we really kind of, where did we start? How did we get involved in this? Well, I think we got involved back in 2013 looking at ovarian cancer, but it was probably back in the late 1980s, when a physician realized that his patient was really telling something important when she said that the dog kept chewing at a mole, and that mole turned out to be melanoma. And we have many, many stories of people whose pet dogs started to really pester them or bother them, and they sought medical care. And in some of those situations, it turned out to be cancer. And the dog, once the cancer was treated and resolved, the dog stopped doing that. So very compelling that these dogs were picking this up without even any training. But our goal here has been to train dogs and train dogs to identify cancer, particularly ovarian cancer, because ovarian cancer is a really devastating cancer and there is no early screening test for it. But what we do know is that if it's diagnosed early, then most of the people are going to survive. Unfortunately, most of the cases are diagnosed late, and that really gives them a very, very guarded survival rate. You know, many of those patients will die within 5 years. And so we worked with dogs to see if we could identify an odor associated with their blood. So they would send samples to us in the lab, and we would train the dogs, and the dogs were very capable of detecting whether that patient was an ovarian cancer patient or a normal control, or a woman that had a benign ovarian problem, something like an ovarian cyst that wasn't cancerous. So this was our introduction into medical detection. It was also the beginning of a wonderful partnership with Dr. Charlie Johnson and Dr. George Preddy. These were our partners in developing other sensing devices. And so Dr. Preddy was working on a chemical sensing device. So he looked at the volatile organic compound signature. Dr. Johnson was working on an electronic sensing device. So basically an electronic nose. So ovarian cancer, again, was the beginning, but we also have worked on a condition called bacterial biofilm. So many people get knee replacements, and this is an x-ray of a knee that has an artificial knee in it. So that metal has been put in there so that person is no longer suffering with the pain of terrible arthritis or a broken down knee joint. But what we do know is that about 10 to 15% of these implants can get infections. And down on the bottom x-rays here where the red arrows are pointing, you can see that the bone is no longer nice and smooth, and this metal piece is no longer sitting properly in here, and that's the result of an infection. You can see those changes when you compare it to the nice normal to this abnormal, this infected prosthesis. And what we know is that it's very difficult to make these diagnoses. And so what happens is we were able to get samples from people that had infections and samples from people that did not. And the dogs were able to detect the difference. And so that's an exciting new area as well. We also are interested in one medicine. So one health, one medicine. And that means not only for human partners, our dogs working together with humans, but we're also interested in animal health and environmental health. And one of the projects that we've been working on most recently is a disease of deer. It's a prion disease. So this is a disease caused by a misfolded protein. It's a very strange type of disease, and it is like BSE or mad cow disease, but it affects deer and elk and mule deer. So this group of animals called cervids. It's called chronic wasting disease. And what we've been able to do is we've been able to train the dogs to actually identify what deer have been affected. And we do this by collecting their poop samples. So it's pretty non-invasive, whereas the only other way to diagnose it is actually after they've been killed and to test their brains. And so we're really excited that we might have a way to diagnose this early, again, in our deer. But what people are really interested in is certainly the role for the dogs in COVID-19. And so we have conducted 2 studies in the midst of our second study right now. But what we wanted to do is we wanted to determine whether or not the dogs could identify an odor that was associated with COVID-19 or the virus SARS-CoV-2. So we were enrolling patients that were tested for COVID-19. And so we had patients that were tested positive and patients that were tested negative. In the first study, the one that we just published, we had the dogs trained on urine samples from patients in the hospital. And these were both adult patients and children. And they were, again, positive patients and negative patients. And we trained the dog to recognize the odor that was in the urine. Now, the important thing to realize is that the dogs never had direct access. They only could smell the urine. And all of these samples were virus inactivated. So they were actually very safe to work with. So there was no risk to the humans working with these samples or to the dogs. And so we were able to determine that the dogs could detect a unique odor that was associated with a COVID-19 infection.
Dr. Otto talked about biofilms. Biofilms are one of the major causes of corrosion that cause pipeline leaks. And if we could have a way of detecting them more explicitly than our current visual inspection or ultrasonic inspection, that would be groundbreaking. So we're going to take that and pursue it. Maria, another question for you. You've been in all of these aspects of medicine and other uses for our dog friends. Would you say that this really should be considered a formal branch of medicine? You know, we can go all about developing machines to do the same thing, but nobody's going to beat these dog noses. Do you think this should be a formal part of training and a branch of medicine?
No. Not a branch of medicine officially, maybe within the working dog world, absolutely. And as I've discussed with Cindy more than once, and it's in my book, the dogs are amazing at this. I actually unfortunately, I have ovarian cancer in my family. No, I don't have it, but I could someday. And I'm really rooting for those dogs at where she is to be able to do this job. Now, you're not going to see these dogs at your doctor's office. You're not going to go see Dr. Dog at your doctor's office because I like to say dogs are only human. They make mistakes. They are not perfect. They may get distracted. They're amazing, but we can't rely on them in person to necessarily diagnose us. They are behind the scenes, and when she comes back, she'll be talking about how they are working on, well, she already did discuss this about Dr. Petty, working on ways in which maybe we will be able to one day breathe into a tube, and what we've learned from the dog's nose will indicate that, this is the profile that the dogs would smell, and maybe this is something we don't have to worry about for another year. And I think Cindy's going to be able to talk about the e-noses. Maybe she'll do that a little more. But yeah, I would say not their own branch of medicine, but an absolutely important role in behind the scenes and with people. Sorry, back to Cindy.
Sure.
I'm talking on my phone because I just got kicked off the university's internet, so I do apologize. And so I'm trying to connect back on my computer, but I'm not sure that that's going to work at this moment. So I think that I can go ahead and continue to talk about. I don't know where I lost everybody.
Well, I think you were to the point, you were explaining kind of what you were doing with the protocol, and I think now perhaps you can jump to the results, because the results of your COVID-19 paper were just remarkable. So if you could kind of go over your results.
Sure, absolutely. So what we were able to show is that the dogs were able to detect the odor associated with a COVID-19 infection in the urine. And so that was again, the urine was inactivated, so there was no risk for the dogs to be exposed to that, and no risk for the people as well. And so we had what we would call an accuracy of about 96%. So the 9 dogs were consistently able to identify the samples that came from patients with COVID-19 or that tested positive, and ignore the patients that were tested negative. We did find out, though, that we had one patient that had tested negative, but recently had been COVID positive, and the dogs were like, yeah, I'm not so sure about this patient. So we don't know how long that odor lasts. So I think that is definitely something that we want to be thinking about when we're using dogs for this kind of work, we have a lot of questions that we haven't been able to answer. And so in those questions are, how long does that odor last? How many things might actually change that odor? We are currently doing a study where we're collecting samples from people in the community. So we are having people who are being tested for COVID-19. They are sending us an email. We're having them fill out a survey. And what's happening is that they are wearing a t-shirt overnight and sending it back to us so that we can go ahead and train the dogs on that. And we've actually come to our first round of training and found that indeed the dogs can identify people from the t-shirt, from the odor that they sleep in, and they can identify the difference between people that have COVID-19, even if they have symptoms or if they don't have symptoms, and people who might be sick with other diseases. And we haven't had every disease possible, but the dogs are very, very specific at identifying that. And so what we're looking at now is, well, where does that go? How do we take that to the next level? And there are a couple of different ways that we can think about that. One way is that we might think about how would we use the dogs to actually screen people in the community. The other is, how do we collect samples from people and screen them very efficiently using the electronic nose device? And we're working to go forward on both of those parameters. So our colleague, Dr. Johnson, who's worked with us on ovarian cancer, has been very successful in kind of moving forward with this electronic nose. And he's been able to show about a 92% accuracy rate with the t-shirts that we have provided for him using his electronic nose. And as a matter of fact, this week, we're moving now from the wheel. And if we can get, you actually saw the wheel in Maria's presentation, but we're moving from that laboratory setting to seeing if the dogs are actually accurate at screening people for COVID-19. So we're very excited about that.
Thank you. Well, thank you, Dr. Otto. That was that's groundbreaking, and it leads to one final question from Eva. And I asked this a version of this. What does this mean for the future of medicine?
I think that this is such a wonderful opportunity, a wonderful place to be, because what we're doing is we're changing the whole paradigm. We have historically relied on different diagnostic tools, but we had forgotten about that sense of odor as a diagnostic tool. And what the dogs are telling us is that there are changes in our bodies that change odors, and those odors seem to be very specific for different diseases. And what we need to do is we need to have the tools to then use that to help identify diseases, particularly at earlier stages. And in some situations, it may well be the dogs. In other situations, the electronic sensing device is going to make more sense. From our perspective, we believe for ovarian cancer screening, that's going to be an electronic sensor, because we can screen hundreds and hundreds of thousands of people very rapidly and very inexpensively. Whereas for COVID-19, it may make more sense when we have large populations of people gathering at locations, if we could have a dog as sort of a preliminary screening to identify people who then need to have subsequent testing. So whether it's COVID-19 or a subsequent pandemic or some other really concerning disease that comes up in the future, I think we have this great opportunity to use all aspects of the biosensors, which I call the dogs, as well as our electronic sensors and chemical sensing. We have got a lot of people who are working on very exciting areas in that field as well.
Otto, and thank you, Maria, for joining us. Well, Belle, I think you have to agree that this has been a highly informative and entertaining Lunch and Learn today. And so thanks again to Dr. Cynthia Otto and Maria Goodavage for joining us from across the country and giving these exceptional presentations. For our audience, please save the date for this upcoming Pumps and Pipes conference which will be held on Monday, May the 17th from 11:30 a.m. to 2 p.m. The theme is inner space, outer space, and the earth between. Join us and learn more about the treatment of pulmonary arterial hypertension, a deadly disease, and a novel imaging technology for its early diagnosis. Learn about 3D bioprinting of the pulmonary vasculature, lung regeneration, visionary designs for space habitats, and robotic drone vessels that are mapping the oceans for climate data.
Steve, before we go, I'd like to offer a special note of thanks to the entire production team from Pumps and Pipes, the DeBakey Cardiovascular Education and Houston Studios, and the Houston Independent School District, who made this Lunch and Learn webinar possible. Most of all, thank you to you students, teachers, and the audience of curious people who participated today. We'll see you in 3 weeks.